In this lecture, we will review acceleration behavior therapy, but we're going to focus on reinforcement, positive reinforcement, and negative reinforcement. Also, how does positive reinforcement differ from punishment? The purpose of stimulus control procedures is to get clients to perform a target behavior. Ultimately, however, for the behavior to continue, it must be reinforced. But what is reinforcement? To reinforce is to strengthen. The term reinforcement refers to strengthening a behavior so that the person will continue to perform it. Formally, reinforcement occurs when the consequences of a behavior increase the likelihood because it is based on the observation that the behavior recurs. Now, the reinforcing consequence is called a reinforcer. An individual receives the reinforcer only if they engages in the behavior. In other words, the reinforcer is contingent upon the behavior being performed. Whether a consequence is a reinforcer depends on its effects of the behavior, not on the person's subjective evaluation of the pleasantness or desirability of the consequence. Reinforcers are defined by their accelerating effects on the behaviors they follow. However, in most cases, reinforcers are pleasant or desirable consequences for the person. Reinforcers differ from rewards, and this is where I want you guys to pay special attention, because a lot of us believe that reinforcers are primarily the same thing as rewards. But reinforcers differ from rewards. Rewards are pleasant or desirable consequences of a behavior that do not necessarily make it more likely that the person will perform the behavior again. Receiving your driver's license is an example. You are rewarded for passing the driving test, but the reward does not result in your taking additional driving tests. Behavior therapists do not assume that a consequence will serve as a reinforcer. A potential reinforcer is identified and then made contingent on the client's engaging in the target behavior. If the behavior increases, then the therapist assumes the consequence was a reinforcer. Besides increasing the likelihood that the behavior will occur, reinforcers have a second function, providing positive feedback which informs people that they are engaging in appropriate behaviors and are performing them properly. For example, when you receive an A for a poem in a writing class, the grade tells you that you have written a good poem. Now let's dive into positive and negative reinforcement. Reinforcement always increases the frequency of a behavior. Let me repeat that again. Reinforcement always increases the frequency of a behavior. This accelerating effect can come about in two ways. When a pleasant or desirable stimulus is presented. So when it's presented as a consequence of a person's performing a behavior, it is known as positive reinforcement, and the consequence is a positive reinforcer. For instance, you hold the door open for your friend who is behind you, and your friend says, "Thank you." If hearing "thank you" makes you more likely to hold the door for your friend, or anybody else for that matter, in the future, then thank you is a positive reinforcer, and positive reinforcement has occurred. The other way that a behavior is accelerated through reinforcement occurs when an unpleasant or undesirable event is removed, avoided, or escaped from. In other words, it is subtracted as a consequence of a person's performing a behavior. This is negative reinforcement, and the consequence is a negative reinforcer. Many everyday behaviors are maintained by negative reinforcement. For example, taking an aspirin is reinforced by relief from pain. Napping is reinforced by decreased fatigue. Turning in a paper on time is reinforced by avoiding loss of points. And driving at the speed limit is reinforced by avoiding a ticket. In each instance, we avoid or escape from something undesirable. Although negative reinforcement plays an important role in maintaining people's behaviors, behavior therapists only occasionally use it as an intervention. Let's dive in now to negative reinforcement versus punishment. Equating negative reinforcement with punishment is a very common mistake. Punishment occurs when the consequences of a behavior decrease the likelihood that the person will repeat the behavior. Let me repeat that. Punishment occurs when the consequences of a behavior decrease the likelihood that the person will repeat the behavior. And the consequence is called a punisher. Thus, punishment has the opposite effect of negative reinforcement because punishment weakens rather than strengthens the behavior. Positive punishment involves presenting, or rather adding, an unpleasant or undesirable consequence. Negative punishment involves removing or subtracting a pleasant or desirable consequence. Punishment always decelerates the behavior, whether positive or negative. And likewise, punishments are defined by their ability to decelerate behaviors rather than their pleasantness or desirability for the client. However, we will assume that punishers are subjectively unpleasant or undesirable, as they usually are for the client. To distinguish the difference between reinforcement and punishment and what is meant by positive and negative, you just have to remember two things. First, reinforcement involves strengthening or accelerating, and punishment involves weakening or decelerating the behavior. Second, for positive, think, quote unquote, a plus, like an addition sign. For negative, think, quote unquote, minus, or a subtraction sign. Now, there are 4 major types of positive reinforcers: tangible reinforcers, social reinforcers, token reinforcers, and reinforcing activities. I want to take some time to go over the guidelines for administering reinforcers and fostering long-term maintenance. Behavior therapists have developed guidelines for administering reinforcers and fostering the long-term maintenance of target behaviors. The following are 7 important guidelines. First, reinforcers should be contingent on the client's performing the target behavior. The reinforcer is administered only after the client has performed the target behavior. Providing a potential reinforcer before the client engages in the target behavior will not accelerate it. Second, the reinforcer should be administered immediately after the client performs the target behavior. Immediate reinforcement is more effective than delayed reinforcement, especially when the client is initially learning a target behavior. Third, reinforcers should be administered consistently. All of the people reinforcing the client's target behavior should use the same criteria for determining when a reinforcer should be administered, and they should administer the reinforcers each time they are earned. Fourth, the client should be made aware that the reinforcer is a consequence of the target behavior. The simple way to do this is to tell the client the reason that the reinforcer is being administered. This makes the contingency between the target and the reinforcer explicit and helps the client remember the consequence, which is important because reinforcement affects the future performance of a behavior. Fifth, continuous reinforcement should be used initially, followed by intermediate reinforcement. Continuous reinforcement is optional for initially accelerating a target behavior, and intermediate reinforcement facilitates long-term maintenance, transfer, and generalization. 6. Natural reinforcers should be used in therapy. Employing reinforcers that the client is likely to receive outside therapy also enhances transfer, generalization, and long-term maintenance. And 7, reinforcers should be kept potent. Reinforcers can lose their effectiveness with repeated use. Conversely, the more a client is deprived of a specific reinforcer, the greater is that reinforcer's potency. Reinforcement consistently has been effective in accelerating many different types of target behaviors for clients of all ages and intellect and physical capabilities. Behavior is maintained only if it is reinforced. Procedures for enhancing long-term maintenance, as well as transfer and generalization, employ natural reinforcers, self-reinforcement, natural reinforcing agents, and intermittent reinforcement.